the update on the COVID-19 status in the state as of today 5 p.m. is as follows. The new positive cases till 1 p.m. of today is 15. East Khasi Hills 9. Out of this 9, we have 5 others, 2 from the armed forces and 2 from BSF. Ribhoi 1, West Garo Hills 5. The total number of active cases is 582. In East Khasi Hills, we have 473. BSF 189. Others 224. Armed Forces 60. West Khasi Hills, we have got 5. Ribhoi 55. West Jaintia Hills 16. East Jaintia Hills 17. West Garo Hills 14. South Garo Hills 2. And the number of cases who has recovered till 5 p.m. today is 66. East Khasi Hills 54. Out of this 54, 14 are from others, 1 armed forces, 39 BSF. Southwest Garo Hills 4, Ribhoi 1, West Garo Hills 7. Out of the 7, 1 is an armed force and the other 6 are others. This has taken the total number of recovered cases are 330, and the number of deaths so far is 5. The number of samples we had sent for testing till 2 p.m. today is 38,977. The number of persons who tested negative is 37,584. The number of test results awaited approximately 476. And the number of entrants from outside the state of Meghalaya till 2 p.m. today is 25,218. Okay, anything else? Next containment zone. Bentar kasi te undan na containment zone. Naru bengis dang. Ki total na ki containment zone tengah undan kan ka figure bat ngam mentah. Ni mo. Toh, kani ngan saya kan next meeting, next by tomorrow mo. Toh, anything else?
Can you share with us the outcome of the meeting with the private?
Oh no. See, that meeting we had called is because of, we don't want that incidences which had happened recently, like in Ganesh Das, to happen again, and that patients who come from any part of the state, when they come for Medicare services in any of the hospitals, there should be a close coordination between all the hospitals, so that in case we don't have the bed which are vacant, especially where you have to put them in isolation ward, then they should be in close coordination with the next hospital that they refer, so that it becomes easier for the patient party, it becomes easier for the hospital concerned and for the hospital which will receive the patient also. That is what we had discussed, so that in future we will not have the same type of incident which had happened at one hospital to be repeated, wherein there are a lot of allegations. I'm saying allegations, we don't know whether it's true or not. So that is why we had called, so that we have a close coordination, and we discuss with the other hospitals, so what are the problems faced by them. And it was a very long discussion chaired by the Commissioner and Secretary Health, and I think we had maximum inputs from all the hospitals, and with these inputs now we can better our services to the people of the state in each and every hospital, whether it's public hospital or private hospital. Yeah. See, we have, I think all the hospitals which we had the meeting just a few moments back was this. Their complaint and to us was this, that the people working in the hospital, when they go back home, they are not allowed to enter their home place. They are asked not to come since they are working in the hospital, which I feel is like making them feel that they are carriers of this disease, and which is totally wrong. These are health workers working in the hospital, providing healthcare services. And without them, the hospital can become dysfunctional. And we want all the hospitals at this stage to be functional. That is number one. Number two, we have got a complaint that even patients who are treated in the hospitals, when they go back home, they are told to quarantine for 14 days. This is also totally wrong, because that certificate to go back home has been given by the hospital. And see, no matter how harsh the precautions which we take, the coronavirus is here to stay. Coronavirus will come. Our prevention, our precaution, our efforts is to see to it that it comes gradually. It doesn't come as a surge. That is what we are trying from our side. It will come, and we have to be aware that when it comes, we have to know how to take care, especially at home. So if the health workers, if the patients who are not at all in any way related with COVID, you look them with jaundiced eyes, then what about the positive cases? It is going to happen in each and every house, one day or the other. And when it happens, when you see that there is nothing which can be done at home because they don't allow you to look after the patient at home, then you will feel the pinch. So before we feel that pinch, let us be very clear about this. Let us educate ourselves on this, that COVID is here to stay. COVID will be here for a long time, and we have to learn to live with COVID, and we have to learn how to take care of ourselves to protect against COVID, and even if you get the COVID, how to take care of such patients at home. Now, all those containment zones which we had declared has become micro-containment zones. And some have been lifted. Jhalupara has been lifted, okay, and then Mautawar has been lifted. All right, I think this information we will share with you with this information. But all those containment zones which we had, which district administration had issued orders, those has been limited as micro containments. That means only the houses have been sealed. I think they have already informed me yesterday that they have lifted all those containment zones except tang situ saya capo Khanapara kepada saya bernihat serum. Tamang ipit menta kat kum kikis bengi oro nak itu kita kan kami osho. Tak mor kala ayara. Ketika number nihat serum ni kadang kalong nung ada curfew tu.
Mungkin ini kan berdua kadang hab under curfew.
Kadang ada curfew tu mentah.
Bah, new report pak bagi kadang ini di stone beri belah try kamu itu truk asam kiwa terus ke Jakarta. Pada ekran mengadisi. Kalau begitu di truk hilang.